All right, my lovely mamas who have birthed beautiful children, we're going to go through scar tissue today. Today we're specifically going to go through cesarean section scar tissue release that you can do for yourself. This can be a very emotional experience. It may not be, but it can be linked to some birth trauma if you have experienced that. So go slow with yourself. If you need to make it a little bit more loving, you can, and I'm not joking with this, if you feel it is going to be triggering, it can be really nice to light a candle, to put on some really calming music, have a glass of wine if you feel like it's going to be really full on, obviously not if you're breastfeeding, and just take a breath and remember that you're doing this for yourself, and it can be part of your healing journey. So when we have scar tissue or a Caesar scar, of course, it's not going to be as simple as just skin deep. The scar is obviously right through to the uterus. That's how they get the baby out. So we are just doing the superficial portion. Now, you might choose to do this if you have a little bit of sensitivity, if you have a bit of numbness, if you have a bit of pulling, if you find that your body, since the cesarean, has created an apron, those kind of ideas, or it just feels very noduly, those kind of ideas can be really helpful to potentially release some of the superficial scar tissue. Of course, I do adjusting in the clinic, so if it's something you think may be playing a role in your lower back or your pubic or hip pain that you might be having, then please come and check in. Okay. So if this is the tummy and this is the scar, we're just gonna make it stick out like that. Then what you're gonna do is just get a little bit of oil, olive oil, coconut oil, moisturizer if you like. I like to use oil, and I would be suggesting with the Caesar scar to lie on your back, because you can relax your stomach muscles and let go with your hips and your glutes. So we don't want to create any extra tension around the skin while we do this. We want to stay as relaxed as we can. So just lying on your back in a really rested position. It may help to bend your knees if your scar is really tight, but if it isn't and you have enough skin that you can move through what we're going to go through, then you can have your legs down straight. Just play around with it, see what's most comfortable. Okay, so if this is the scar, then what you're going to do with a bit of oil on your hands, you just smooth the oil over nicely, be really kind to yourself and calm, and then you're going to take your hands and you're basically going to roll the tissue. So a gentle pinch, it doesn't have to be a lot, and just find the scar and roll across it like this. Now, if you can't grab the back, which most of you won't be able to, if you can't grab on both sides, then what I would be suggesting that you do is just with the oil over the fingers, first and second, you're just going to be rolling over it like this. So keep the flow nice and pulling up towards your head. And mostly I would suggest going from left to right, because most of the time, in my experience of adjusting C-section scars, I think my theory is that most surgeons are right-handed, and so they stitch across to the right, so it tends to sort of drag and get contracted into that position. So if you need to, then go from left to right, but if it feels better for you to go from right to left, perfectly fine. You have a play around with what feels best for you, so you're just going to roll over it, and then when you feel more comfortable, there's a couple things. First of all, you can put a bit more pressure in where it feels really tight, if you like, and just start to use a bit of heavier pressure, and basically want to get to those deeper layers and break up a little bit more of the tissue, or you can stay light for as long as you need. And then the other thing to consider is if it's really good but you've got one section that's really noduly, then you can just focus on that. The next tip, so that's the rolling massage, the next tip is you can just go along the scar and see which sections are harder to move towards your head. You might find that you go to move some and there's just no movement, but on the next bit you get a really nice bit of skin elasticity. So find the bits that are really rigid, and you can pull up under the scar and just hold pressure there. Now, it's probably going to be a little bit tender. You don't want to hurt yourself, but the tenderness is okay, but just do it to tolerance, that's fine, and just hold and then for about 30 seconds and sometimes up to 2 minutes, to be honest, and slowly it will start to release a little bit. Now, it might not be as beautiful as the rest of the scar, but we're going to do this over time. So hold and wait, and then when it starts to let go, you can let go, move on to the next bit, hold and wait. That's the next tip. Then the other thing that I would suggest is just doing a general effleurage at the end. So you take both hands, come up, underneath, and then rolling right up. So you're coming right up under the scar on both sides. Now, if you have a belly over the top of this, or it's become a bit of an apron position, this can feel a bit confronting to do, especially when we're used to, you know, in our brain, like we're always trying to get back to our 18-year-old bodies, right? So this can feel a bit confronting to do, but if you need to, just keep in your mind, okay, as I do this, it might be a good idea to think through something like, I'm really proud of me as a mother. I'm really proud of my body for growing an entire fucking human. Wait, that's amazing. You're ridiculous. You are literally the channel between heaven and earth, and I'm not exaggerating. That is actually true. You are actually the channel to bring a soul into the world. You are actually a channel to create another human life attached to an actual legit soul. You literally created every cell and grew it. What the hell? That is so amazing. Give yourself the credit you freaking deserve. And when you come up and there's a bit of a tummy, be like, there's a tummy because I'm the fucking boss. That's why there's a tummy, because you're a ridiculously amazing creator of human life, and you just like, you know, just casually attached it to a soul and birthed it. Like, it's ridiculous. Make sure you pay yourself homage. It's amazing. And so bringing up over the top and be like, I am the goddess. I am the goddess. I am the queen of all the world. I am the birther of life and the connector of souls. Now, I'm being silly, but I'm also being legit 100% serious. So that might be a nice little trio of exercises that you can do to start to, 1, reacquaint yourself with your scar tissue. 2, give yourself the love and tenderness that you've deserved all along in regards to your scar tissue. And 3, start to help your brain understand that's a new piece of anatomy now. So it can be a little bit confusing for it. So we want to love on it and help break some of it up and make sure there's less pull into your nervous system so that the brain's not confused by the scar tissue. And hopefully you feel a little bit less symptoms if you're getting some tension or soreness or tingling or numbness. Now, I wouldn't start this unless you are 6 months postpartum, at least. Okay? Enjoy!